3D printing, or additive manufacturing, is a process of making three-dimensional solid objects from a digital file. When State Police Trooper Bob Zink of Arlington heard about healthcare providers and workers experiencing shortages of vital protective equipment, the lack of which put their own health at risk, he decided to turn a hobby into a way to fill a need. We'll let him take it from there.
So back in December, I had been doing some research on 3D printing as a hobby, and for Christmas, I, asked everybody, hey, help me with some money for getting one. I did. I picked up this one here. Was doing some hobby printing, making some toys for the kids and that kind of stuff. When everything happened recently with the whole COVID pandemic, I felt kind of odd just sitting home doing nothing, watching Netflix, going to work, coming home. Luckily, I'm an essential employee, so I still am employed, still working. But basically, one of the groups on Facebook that I'm a member of for printing hobby stuff, I saw they were making some medical equipment. And so I looked at it to see what was going on with it, and found a couple other groups that are making face shields, respirators, you name it, for hospitals, because the equipment's really short in supply right now because of the high demand. So I got on one of the groups, found a couple different 3D image files, and said I'll give it a shot. So I started printing them, and I reached out to a good friend of mine from high school who's a nurse down at Bennington Health and Rehab, Mindy Borden, and she said they're in desperate need, everywhere's in desperate need of face shields and equipment. So I said I'll start it, and I did 60 initially and donated them down there to Bennington Health and Rehab. And then obviously there was some press about it from our Vermont State Police page, and because of that I got a lot of requests. I'm probably getting 5 requests a day for 60 to 100 at a time. My wife is actually out of the house right now delivering some to Brownlee Brook Manor up in Manchester. They put a request in the other day, and there's 25 being dropped off right now to there. So basically I got started kind of doing it small, and it's kind of spun up into something much larger. I'm averaging 100 to 200 face shields a day that I'm making, and getting them out of the door, every week. There's a little bit of processing that goes along with it, but it's turned into quite a process.
Trooper Zink explained to us how the 3D printing process works.
So what they're called is a FDM 3D printer, or filament deposited manufacturing. So basically the printer, what it's doing is taking plastic that's it looks like weed whacker filament basically, and it pulls it down inside of the machine, and inside of here is what's called a hot end, and it heats up that plastic to a certain temperature, and uses computer program code that tells it where to put the material and how much, and when to move. And basically it's drawing each layer out as it goes, building a 3D image out of the files that I find or make. So essentially it's making it from scratch using plastic.
So how many do you figure you've made and distributed so far?
Right now, between face shields that's printing right now on this machine, and some other things that I'm printing called ear savers, which is kind of important for medical staff. They're having to wear masks, as we all are now, but they're wearing them for 12, 16, 18 hours at a shift, and the masks that they wear, the surgical style, kind of wear on the back of their ear, so it's causing them some pain and discomfort and problems, sores and things. So again, the public resources of Facebook and groups that are putting stuff out, some people created some files rather quickly and pushed them out to the public, and we've been printing those. Between face shields and ear savers, I've probably put out right at today 3,000 different pieces of medical equipment. I'm also working, this isn't a solo job, I can't do this on my own. I'm working with several people from across the state. There's another trooper, Russ Robinson, Sergeant Robinson up in northern Vermont, who's helping out. There's an individual citizen over in Warren, Vermont, who's helping out. There's an individual, a member of IT department at SVMC, Mike LaRoche. He actually just bought his own printer. Saw my posts, bought his own printer, so I've been walking him through it, and he's starting to print up some stuff for Bennington Hospital. And then Adam Canastrossi down at the Career Development Center, the CDC at Bennington, along with James Salerno, are making thousands and thousands of face shields. They've been kind of doing this prior to me getting started with it. We've partnered up to try and figure out what's the most efficient way to do it, where it's needed, and trying to work to get the materials where it's at. I know the CDC ran out of equipment, The material, the actual filament that's here, it's really hard to come by because there's a lot of 3D printers out there right now doing the same thing, which is fantastic. But because of that, there's a shortage, so I was able to get my hands on a dozen rolls, and I fired them right off to Adam Canastrossi at the CDC, and he's been continuing to print, able to keep pushing out. Probably, hopefully this month he'll get 400 out the door.
So you figure you'll just keep going until the emergency is over? And
Yeah, I mean, unfortunately, I think that, we're not going to see this just go away. It's not like the standard cold. So I think that we need to kind of be prepared, and at the very least, do what we can now, but make those contacts between each other so that if something comes up like this again, we can just start, and we already know what we're doing. We already have that network made. You can find Trooper Zink's Facebook page at Vermont COVID-19 Volunteer Network. It's a reminder that we really are all in this together. For the GNAT-TV News Project, I'm Andrew McKeever.